We see mental health as personal, but its untreated costs are everywhere, hiding in plain sight. A recent study found untreated mental illness costs the U.S. economy $282 billion a year, far more than we knew. This is a global issue. Worldwide, lost productivity from depression and anxiety costs about $1 trillion annually. It surfaces at work, where 77% of employees silently push through mental health crises, a hidden productivity drain. We will now show the full spectrum of these hidden costs and then present a powerful, accessible solution: outpatient therapy. Let's detail the numbers. Unresolved depression alone causes a 35% productivity drop, costing over $210 billion a year. For businesses, the damage is direct. Nationwide, employers lose $105 billion annually to turnover and lost productivity. The $282 billion figure is so high because it includes overlooked factors, like reduced spending and stunted career growth. The financial numbers are staggering. But the costs are not just monetary. What is the physical price our bodies pay? Research shows a clear link. People with untreated conditions have a much higher risk of chronic illnesses like heart disease. It also worsens existing problems. Mental distress can heighten pain sensitivity, making chronic conditions harder to manage. But how does this happen? What is the biological chain of events that connects a thought to a physical disease? The answer is in the body's stress response. Untreated conditions can keep this system on constant high alert, flooding you with cortisol. This constant state of alert weakens the immune system. It's like running an engine at full throttle until parts begin to fail. This chronic stress also drives systemic inflammation, a primary factor in heart disease. The connection is a direct biological pathway. We see crippling economic costs and severe physical consequences. Inaction is clearly expensive. Now let's look at the ROI of a solution. Outpatient therapy provides a path forward without pausing your life. It offers structured care while you manage work and family. A major barrier is affordability, and this model is inherently cost-effective by removing the need for expensive overnight stays. For a mind that feels chaotic, the program's predictable schedule becomes an anchor, creating protected time for healing. It is flexible, affordable, and provides structure. But what actually happens in outpatient therapy that makes it work so well? Its greatest strength is its function as a real-world laboratory. You apply new skills immediately in your daily environment. This is about building a practical toolbox with concrete skills. Breathing exercises, methods to reframe negative thoughts. This approach cultivates agency. Actively using these tools in your life gives you a central role in your own recovery. Recovery rarely happens in a vacuum. This model helps you integrate your existing support system of family and friends. A real-world lab and a toolbox of skills sound good. But where is the proof? Does this model prevent the worst outcomes? Recall the chronic costs we discussed? Data shows early intervention is the main way to prevent them, and this model is designed for that. Here is the evidence. Patients moving from PHP to IOP care can experience a significantly lower risk of needing an emergency room visit. A drop in ER visits is a major health outcome and a massive economic one, directly cutting the highest costs of untreated illness. This demonstrates the model works. It links the real-world approach directly to preventing the billions in costs we started with. The choice is clear. One side has staggering hidden costs. The other has a flexible, proven, and cost-effective solution. Beyond the statistics, this therapy provides that anchor in a stormy sea, allowing healing to happen within the context of a life. Can you really continue paying the price of ignoring your mental health? If you are struggling, know that effective integrated help is available. Taking the first step is a sign of strength. You would be surprised at how the effects of treatment cascade through all aspects of your life. So stop paying the high price of silence. Start investing in your recovery.